A geriatric nurse, or gerontological nurse, is a nurse who assists in caring of aging and elderly individuals. Geriatric nurses are some of the most essential healthcare professionals required in the hospitals. They are basically trained to perform need-based nursing tasks. Geriatric nurses can also pursue special training which eventually helps them better understand the distinct needs of elderly people. Being employed as a geriatric nurse is often very gratifying and rewarding. While you choose to become a geriatric nurse, you need to assess yourself personally. Geriatric nurses requires to be of an upbeat and a cheerful personality. Being patient, understanding, empathetic, and compassionate, with a true desire to work with aging patients are some of the attributes of a geriatric nurse. However, the work can also be frustrating or disheartening at times as well, but geriatric nurses should also be able to handle stress and bounce back from depressing events, such as the death of a patient. Geriatric nurse is caring old patient. In-depth knowledge and skills are needed for the nurses to take care of the elderly patients. Nurses should inquire about the present and past illness of the patients as they are likely to have one or more chronic health conditions. Elder patients need more health care services in comparison to younger ones. Therefore, it is essential for all the nurses to have dedicated knowledge about older adults. Attributes required of a geriatric nurse. The geriatric nurses should possess these attributes that are listed below. 1. Patience. 2. Compassion. 3. Empathetic. 4. Strong attention to detail. 5. Creative. 6. Consistent. 7. Cheerful. Roles and responsibilities of a geriatric nurse. Geriatric nurses are required to keep patient records and coordinate with the physician's recommendations. They are not only accountable for patients' physical well-being, but for their mental and emotional well-being. There may be times when these elderly patients will appear to be depressed or angry, due to their deteriorating health, lack of freedom, and isolation from their loved ones. As a geriatric nurse, you need to be watchful for patients and try to remain cheerful and compassionate, even during these challenging times. Geriatric nurses should usually be encouraged to connect with patients' family members. There's always a need to explain about patients' care routine or medications or act as a link between the family members, the patient, and the doctor. The following are the responsibilities of a geriatric nurse. 1. Assessment of vital signs. 2. Administration of medications and injections. 3. Helping patients with their activities of living such as bathing, dressing, and using the bathroom. 4. Assist in range of motion exercises and massaging. 5. Observing for signs of abuse. 6. Assisting physicians during exams and procedures. 7. Transporting patients to doctor's visits and other appointments. 8. Making a nursing care plan for the patients based on the assessment. 9. Educating family members about a patient's condition. 10. Promoting self-care skills. 11. Assess patients' mental health and cognitive skills. 12. Provide a safe environment such as prevention from falls or accidents. 13. Oversee the nutritional needs of the patient. 14. Maintain accurate and complete healthcare records. Challenges and overcoming complexities. Geriatric patients often require more physical assistance as their bodies become more complex and complicated with their growing age. Patients in their end-of-life care can be stressful and exhausting, which can drain nurses emotionally. Management of chronic illnesses, comorbidities, and medications needs a strong knowledge base and varied range of skills. Geriatric nurses needs to think critically and listen to the needs, wants, and feelings of the patient. Nurse helping an elderly patient for walk. Loss of independence could also be a struggle with the elderly patients. Some elderly patients might practice high level of independence, while others would completely rely on their family for activities of daily living. Thus, there are chances that they might fall into feelings of resentment, embarrassment, or grief. All aging people are distinct in their pattern of thoughts, capabilities, and worldviews. The physical strength, memory and senses keep declining with the growing age. It's imperative to keep an open mind and avoid assuming regarding anything related to the patients. Every patient has their own individual experiences and the lives they've lived so far. Rewards of being a geriatric nurse. Nurses are in contact with patients than any other healthcare worker. Since you work as a patient advocate, it is essential to understand the need of building a positive relationship with elderly patient and his or her family. It requires high levels of patience, empathy, and compassion. Valuing and forming relationship with elderly patients gives you so much joy and satisfaction in the work. Overall, it is a rewarding and a pleasant experience. Also, it gives a platform to learn diverse perspective of life and experiences and can lead to better understanding. Patients will be comfortable, feel more supported, will be honest and more cooperative over time, if you respect your patients and express gratitude. If you are planning to become a geriatric nurse, you must keep in mind that the aging process affects everyone differently. Career overview for geriatric nurses. Geriatric nurse work in hospitals, clinics or residential facilities for the elderly. Some may also work as home healthcare nurses. They usually complete their basic nursing education. Some may opt for an additional gerontological nursing degree. There will always be a high demand for geriatric nurse professionals as the aging population continues to grow. This would require specialized nurses and thereby would help in expanding their career opportunities. Growing individuals also possess multiple ailments and requires patient-focused care. Specialized nursing care can only help improve their quality of life of the vulnerable population.